Hi, I'm Alyssa Lanham, and I'm going to be performing a first half of the head-to-toe assessment for the class health assessment for the BSN program here at Mercy College Nursing. With me I have Lane, so he's going to be letting me perform general assessment on him. Before we came in here, we performed hand hygiene. We gathered our appropriate supplies. Also, when Lane was walking in here, I was noticing his gait and his posture, and his range of motion. So his gait, posture, range of motion all seems to be normal, and no involuntary movements noted. So all through this assessment, I'm going to be checking his skin. I'm going to ask him generally about his skin. Do you have any issues with your skin? Any open areas, any sores, tenderness? No, nothing? Okay. And then also going to be asking to see his nails. So just checking the degree of his nails and also cap refill. So his degree of his nails are less than 160, and cap refills are less than 3 seconds. Also, his nails seem to be clean, neat, no problems noted with that. Also, for this whole assessment, I'm going to be paying attention to how he interacts with me, noticing his mood, his affect, his orientation, making sure that's all appropriate. So he does seem pleasant, with good affect through all this. And so then also noticing too nutritional status. So just noticing that he is appears to be normal weight. We have to do more tests to check that. Doesn't seem to overweight or underweight. And then we'll ask him about his nutritional status. So how many meals do you usually eat a day?
Usually 3.
And how much of your meals do you eat? Okay, so that's all seems to be within normal. So I'm just going to start with his head, just noticing his hair, noticing that it's all intact. Do you have any trouble, any brittleness falling out? No. So I'm just going to go ahead and palpate his head, looking for any bumps or lesions here, or any tenderness. Do you have any tenderness at all?
I do not.
Okay, good. So then we're going to go ahead and check his head, just checking his sinuses. So you should feel some pressure as I'm pushing on your face, but he shouldn't feel any pain. So do you feel any pain? Any of that? Okay, good. So then I'm going to go ahead and check his Team J joint. So have an open and closed mouth. Close. Normally that should be a nice fluid movement. Lane does have trouble with Team J, so it is kind of a nice kind of popping motion, and he doesn't have pain in the jaw. So that is abnormal, but that is what he has. So now we're going to go ahead and move on to the ears. So first, inspecting the ears. Do you have any trouble hearing that you know? Any history of trouble hearing? Okay. Any discharge, drainage, infections? Okay, good. So we're just going to first just kind of inspect, feeling for any abnormalities. No, they seem to be good and center on the head, which is a good sign. I'm also going to be kind of pulling, which is a good thing to do before I grab the otoscope, just to see if there's already some tenderness with me pulling his pinna up. So since he's an adult, he's considered an adult, we're going to go ahead and pull the pinna up and back. So I'm going to grab my otoscope. I'm going to hold my otoscope with my dominant hand, and I'm going to pull the pinna up and back. Also careful not to put the otoscope too far in your canal. Okay, so I can see the tympanic membrane, and it's good pearly white, slightly translucent, which is normal. The ear canal appears to have no sign of trauma or any kind of infection noted. So we're going to do the same thing with the other hand. Keep my dominant hand up and back. Okay. So same thing with that. The tympanic membrane is pearly white, slightly translucent. Your canal doesn't appear to have any sign of trauma or any signs and symptoms of infection. So we're doing that. I'm going to go ahead and test his hearing slightly. I'm going to do a cover whisper test. So I'm going to have him occlude his outer ear back and forth. And then I'm going to whisper a phrase and have him repeat it back to me. So I'm going to... Very good. Other ear.
Baseball.
Very good. So his hearing does seem to be intact. So now we're going to go ahead and move on to the eye assessment. So first we're going to be checking his level of orientation and asking him for his name. So tell me your name. Can you tell me what today's date is?
February 19th, 2015.
Very good. And then can you tell me where we're at?
Mercy Hospital.
College
of Nursing. Mercy College of Nursing. I know where we're at.
Yes.
I know where we're at.
Thank you. And then why are we here today?
General assessment, I believe.
Yes. Okay. So all those are normal. And so we're going to go ahead and we're going to check his vision. So we're first going to check his peripheral vision. So I'm going to wiggle my fingers, and then you look straight ahead, and you tell me when you can see them. Okay? And then...
Turn it back now. Turn it back in. Oh.
The corneal light reflects, so the light is seen.
Okay, good. So that all seems to be normal. So we're going to now check his 6 cardinal signs and gazes. So we'll just have him follow my finger.
I will trust me after me and my.
So he's able to follow my finger. Good. He's got good eye movement. So now we're going to go ahead and move on to a cover test. So I'm going to have him look straight at me. I'm going to cover one eye at a time. And his gaze should remain fixed, not deviated at all when I cover one of his eyes. And they are, so that's a normal finding. And so now we're going to go ahead and just kind of look at the outside of the eye, looking at the sclera, the white of the eye. It is white, not yellow. I'm going to check the conjunctiva. It's a nice light pink color, which is a normal finding. Also his cornea and lens all seems to be intact. So we're going to go ahead and move on, and we're going to check his pupils reaction. So I'm going to have you look. I'm checking both sides when I shine the light, even on one side, just to make sure that both pupils constrict and are good, equal and reactive. So they're good, equal and reactive, about 3 centimeters. So now we're going to go ahead and check for accommodation. So I'm going to have him look at my finger and then focus on a far point in the wall. So if you just look at my finger and the far point of the wall. Look at my finger, and the far point of the wall, and try to do that without looking. So your finger, the back wall, and your finger. Okay, good. And so what I'm looking for is to see that his pupils constrict and constrict when he's looking using his near vision, and then dilate when he's looking further away. You doing okay, Frank? Okay. Okay, good. And then if I was to use a Snellen vision chart, I would have him vision test. I would use the chart, have him stand 20 feet away, read off the letters, and with one eye at a time, and then see if he has 20/20 vision or better, just to see, check and make sure that he can visualize things from a distance. So now that we've checked his eyes, we're going to go ahead and move on to the nose. So I'm going to change the tip on the otoscope, and I'm going to be checking his nose to make sure. Do you have any pain, discharge, bleeding, any history of trauma through the nose? Okay, good. So what we're going to do is we're going to have him tip this tip his head back, and I'm going to be trying to visualize the his mucosa, the turbinates, and his septum, making sure all those are intact. So I'm just going to do that. Okay, it's good. So his septum seems to be midline. Mucosa is good and pink, and no trouble with turbinates. So I'm going to go ahead and move along to his mouth. So you can look straight at me now. So I'm just going to have him smile at me. Opening your mouth. Okay, and then I'm going to ask you, do you have any trouble with your mouth? Any pain?
No.
Bleeding of gums? No trouble with that. So I'm just going to go ahead and check his buccal. So I'm going to have you take your mouth. There, thank you. Okay, and I'm checking his buccal and also his gums. So his gums are good and pink. Next slide, please. And his buccal and gums are good and pink. No bleeding, swelling, or tenderness noted. I'm also going to have you look at the floor of your mouth. So if you can put your tongue back and look down for me a little bit. You're a little tall. Thank you. Okay, and then stick up your tongue. And then I'm going to check the hard and soft palate. And then I'm also going to be checking his uvula and his tonsils. So if you can stick out your tongue again. So his uvula is midline. Tonsils seem to be 1+ grade, which is normal. It's mainly over to the side, completely to the side. Also going to ask him about his oral hygiene. So what is your daily routine?
Brush, floss, Listerine.
Okay, that's good. So you don't have any trouble with that? No. Okay. All right.